2010 meeting of the Radnor Township Board of Health is now in session. Please join me in pledging allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Before we get to the minutes, one announcement. There is a meeting coming into this room at 6 p.m. this evening, so we do have to be efficient and get out of here by that time. In your packets are the minutes of the September 20th, 2010 meeting. And I'll entertain a motion to approve. Dr. Humphrey has moved and Ms. Wishner has seconded. Any discussion? Any corrections, additions, deletions? Okay, hearing none, we'll take the vote. All in favor? Aye. Any contrary? Minutes are approved. Move on to the announcements and health officers report.
Good afternoon. I have no announcements for tonight. I received no calls from any board members. During the month of September, we did 34 food safety inspections throughout Radnor Township, resulting in some issues with a couple of food facilities that we resolved. 11 bathing place inspections, 6 citizen quality of life issues, and several meetings, one of which was the Delaware County Local Boards of Health. Under special events, we had on September the 19th, which was my birthday, we had the Fall Festival. We have coming up, we had the Conservancy Party at the Willows, which was a nice special event. And coming up on the 24th of this month, we have the Harvest Festival at the Willows. Under informational items, we have Chapter 115, the Animal Ordinance, which this board is prepared to discuss this evening. Also in your packet, you have locations where you can get, residents in Radnor Township can get flu shots within Radnor Township. That schedule, October the 18th, today as we speak, residents can go to CVS Pharmacy at 316 East Lancaster Avenue from 4 o'clock to 8 p.m. this evening and get their flu shots. In your packet, you'll find some information regarding Tdap vaccinations that the Pennsylvania Department of Health provides free. You can call their office at the regional office in Chester, PA, and which is 610-447-3250, and get your free Tdap vaccine shots. I'd like to bring your attention to Friday of this week, October the 22nd, I think Friday is, where at Tinicum Township Fire Department, we're going to have drive-through flu shots. You never have to get out your car. Just come down anytime from 10 o'clock to 2 p.m. and you stay in your car. You can bring as many people as you want, and the flu shots are free. It's a cooperation between the Pennsylvania Department of Health, Delaware County local health officers, Intercommunity Health, and we sort of work the line and guide you in. And last year, this was very successful. It was a day and a half, and we were able to administer 1,200 flu shots during that 2-day period. This year, it's a 1-day. So it's free, and it's for, if you come, if you're in Delaware County or state of Pennsylvania, because the state provides it, you can get free flu shots. Again, that's in Tinicum Township firehouse, and you never get out your vehicle. Several months back, we did a class here in this room for certified food safety professionals. The Department of Health requires that every food facility has to have one person in a supervisory position that is certified on food safety. What we did was I brought in a instructor who has a special dispensation to teach the class, the regular 2-day class in a 1 day. They have that special dispensation because of their success rate in training and having a high rate of success as far as passing the exam. During that class, we had 17 people take that class. 16 people passed the test the first time, which was a 94% success rate. We have that class. We're going to have it again on January the 28th. I sent a email out to all my food facilities that I have, all the ones that I have their email address for, and the response has been tremendous. So the class, I believe, is pretty close to being full, if not full, now. So it's a big interest. Also, I had one health alert. It was actually a health advisory for an influenza outbreak in southern Pennsylvania nursing home, and I sent that on as I received it. Mr. Chairman, so ends my report.
Thank you. Any questions, comments?
Yeah, I had just a couple of comments. Well, thank you, Larry. One is just for I'm not sure if you said this or not, but the drive-through flu vaccine clinic is for people 9 years of age or older. And just a comment about the Tdap, the tetanus, diphtheria, acellular pertussis. One of the things that they're doing on the suggestion of me and other people is to try and focus that to some extent on, or to make a special offering of that to child daycare workers, because the real focus of that is the ACE-P part of it, the acellular pertussis or whooping cough part of it, and people who work in daycare often kind of fall through the cracks in terms of outreach for health care prevention, even though they are, such a primary group of people working with children. So they are doing some outreach. They've notified all the Department of Public Welfare licensed daycares as well as Head Start daycares in the county, and are making a special effort to have those people take advantage of that offer of the free Tdap vaccine. So, trying to put the epidemiology into practice. So, just a comment.
Thank you for that information. And anyone else? Okay, we'll move right along. I'm going to play a little fast and loose with the agenda and move on to number 7, because we do have a citizen who wants to comment on the proposed revisions to Chapter 115, and rather than detain her, before that, let me just indicate to those members of the board that the proposed revisions that were included in your packets were not the correct ones. You have the correct ones at your place this evening. It's the one with the red ink indicating the proposed revisions. So that's the one we will be referring to this evening. Ms. Falcone, if you'll come to the podium and please indicate your full name and address for the record.
I'm Julie Falcone. I live on Aberdeen Terrace in Radnor Township. I have animals that go to Dr. Donato's practice. And when I took a cat in with a swollen face last week, I was told that it had to be cleaned up, booster updated, current vaccines all the way around, and he had to be quarantined for 90 days. And I have to tell you that that is so ridiculous. It's either saying that the rabies vaccines don't work, which is the only reason that you would be quarantining a vaccinated animal, or And if they don't work, we shouldn't be giving them until after they've been, I mean, this was probably a scratch mark from my kitten or my old cat, who has a tendency to bite, and not a wild and vicious animal. And I don't understand the 90 days.
Dr. Donato, would you care to respond?
Hi, Julie. The 90 days is, at its most basic level, unfortunately, something that the state imposes. That's the first thing. They require a 90-day quarantine for vaccinated animals, even though they may be very well protected against rabies. And the logic behind that is that nobody knows for each individual animal what its own protection against rabies is, even though
So we
they've
shouldn't be
received.
getting rabies vaccines? I mean, is that what we're saying here?
Well, again, required by Pennsylvania state law that rabies vaccines, they are required by the state. And unfortunately, we can't be any more lax than the
TE is.
state. Not for the 90-day.
Yes, they are. I have an email from their health officer saying the animal would have been cleaned up, boosted vaccine, and sent home
Right.
on their own.
Right, and we.
No quarantine.
They actually refer to, in Chester County, to the state for these, and the state says 90 days. I'm not sure if you have that. I would love to see it, but I am in close communication with the state, Dr. Eliza Simeone. I mean, I'll have to.
Days, and there's one, I have one for 45 days from Montgomery County. I didn't bring it with me. Didn't want to read that one.
Isn't the idea behind it that no vaccine is 100% effective, and because, can I just finish, please?
Yeah, I'm saying anything.
And
I'm ready.
You have your mouth open. And that because rabies is such a serious disease, that this is the sort of the fail-safe, that's because it's such a serious disease, and the vaccine is not 100% effective. And if the animal were unvaccinated, it's a longer quarantine period. So this is a shorter one.
No, it's not.
I guess as I'm reading this email, it's, I hate to say, it's just not correct. I mean, I'm not sure what more to say than that, because we know, and I don't have a copy of PA state law with me, but it does say wound of unknown origin, 90 days quarantine.
I can guess where it came from. That's what's
Sure.
just infuriating. I mean, it's causing havoc in my house. The cat's gained 2 pounds from laying around doing nothing in the basement. Kitten has nobody to play with. And as far as the vaccine not working and all of that, the other side of that is that sometimes the rabies doesn't come out for a year. So why 90 days? Why not a year? Why,
Yeah, it's 6 months for rabies to develop in the dog and the cat. 90 days, if they are exposed to an animal with rabies, within 90 days they can develop rabies, and that's why that quarantine is there like
You can
that.
develop it in a year, according
No.
to what I read on the website.
No, 6 months is the max, and that's been proven through a number of sources, and CDC has also made these recommendations based on research.
All right, one more question that I don't understand either. This was clearly a claw wound, being at 3-point. There's nobody with teeth like that. And rabies is transmitted by saliva.
And again, I'd have to double check, but anytime there's a wound with pus in it, especially about the face, it's not necessarily a scratch or a bite. I mean, I felt like, again, it looked like a potential bite wound,
There
and
was
that's hard to say.
One here and one here.
Right, and that could be individual bites, but also during these fights too. I mean, the animals do lick themselves and groom themselves and their saliva on their claws as well. But I know it's frustrating.
I give up. All right. I'll let you go on with your meeting. It doesn't make any sense. I'm going to take this back, though, if
Okay.
you don't mind.
All right. I'm sorry that it's not so.
No, it's just.
It's frustrating.
Not only that, but the vaccinated animal that bites them, they get to sit around and do nothing for 10 days while your animal is quarantined.
Well, yeah, if they know that what animal actually did that, then that animal's quarantined for 10 days.
I would bet that if the community knew those rules, they would never tell you that they weren't sure like I did. And that, it's just thanks.
Thank you. We'll move on to discussing the draft. Dr. Offit, just before you came in, I had indicated that the draft of the proposed revisions to Chapter 115 that were distributed in our packets that were mailed to us were not the correct ones. The ones we're using are the ones with the red ink that is at your place. So that's what we want to pay attention to. Let's then discuss this, and I'll ask for any questions, comments. All right. Perhaps we ought to proceed.
Just one question. Is this the draft that we have now that was on the scroll?
That's the draft that was on the township website.
Right.
Yes.
Thank you.
It is on the township website, it's still there. Can we have someone move to adopt this? And the motion should include something with regard to transmitting it to the Board of Commissioners of Radnor Township. Anyone care to move on that?
I would like for us to, I move to adopt the current Chapter 115 and move it from the township to a letter we're going to present to the commissioners.
I second that.
Okay, and I would just amend that. You said current, Dr. Donato. I'm sure you meant to say the proposed revisions.
Current
that we have.
proposed revisions, yes.
Thank you. Any discussion on that motion? Hearing none, all in favor, say aye.
Aye.
Any contrary? So moved and so ordered, and I will undertake to draft a letter, which I will circulate via email before we send it on to the township commissioners, if that's agreeable to everyone.
I just wanted to bring something up that I was thinking about this in sort of a practical way, and I guess, Dr. Donato, I want to ask you about this. Because in a way, for the user, the owner, it would be really nice and easy if there were a way to sort of submit your licensing application when you're at your veterinarian's. Like, so in other words, as you're there, you would, so the whole thing gets sort of done, like you're there, your animal gets the rabies vaccine, so if that can somehow go directly to the township from your office, essentially, with the person there instead of the person then taking, it's just like, I mean, it's sort of this principle, anytime people have to take an extra step, things fall through the cracks, the more it can be done at the same time. So, and, you know, your office, one's office, the veterinarian's office could, you know, charge a fee for doing this extra bit of work. But if there's some way to, in the practical world, to make that happen, I think it would really facilitate people licensing their animals.
Sure, and I think that that's a service that any veterinary hospital can offer. The unfortunate thing is that, you know, our residents go to, you know, a number of different veterinary hospitals, and to somehow get it where everybody will do that, that is, you know, that would be challenging, but certainly, you know, our office can offer that, And certainly we can contact St. George Hunt's practice as well, and those are the two in our township, and we can attempt to organize something like that. I don't think it'll be too hard with two practices.
Great, thank you. Any other comments, suggestions? Before we move on to the next item, I'd like to take this opportunity to thank the ad hoc committee for doing a tremendous job with the proposed revisions. That's Doctors Alford, Donato, and Humphrey. You've earned our thanks for sticking with this. It's taken a while, I know, but I think the outcome will do a great service to the citizens and the animals of our township. I'd like to now move back to the liaison reports. Mr. Fisher, do you have anything from the Board of Commissioners?
We have nothing for the board at this time, but I will ask that the Board of Health members do put forth either informational pieces and or, in this case, a draft ordinance for the Board of Commissioners' consideration. I think we have an opportunity for more promotion of information and ideas through the Board of Commissioners, and announcements for vaccines, announcements for various things can be done through the Board of Commissioners. So if there's any way the Board of Health can put together a list of items for me to bring to each meeting, that would be appreciated.
Thank you. Radnor Reach, Ms. Wishner?
Yeah, I have not heard back from them, and I have looked on the school websites, and I don't see any events upcoming with Radnor Reach, so I did email them again. I had emailed them about 2 weeks ago saying, I unfortunately couldn't come to your meeting, but what's happening? I'd like to help. I didn't hear back. So I did email them again this morning, and, hopefully I will hear back, but I don't see any upcoming events planned. So I'm not quite sure what's happening with them.
The contact person is Christy Shug, is that correct? And she hasn't gotten back to you?
Right.
Okay. Could you take maybe 30 seconds and just remind our viewers what Radnor Reach is?
I would like to say I remember what the REACH stands for, except I don't, so maybe someone here does. But it's the idea is to work with youth in the community and parents around a variety of health issues, drugs, alcohol, mental health, and to provide information about emerging issues, to try and be in touch with what is really happening. I know they had a presentation about synthetic marijuana sold over the counter, and gosh, what else have they had? They had a meeting that was more like a political Q&A. I don't remember with who, but it was a political thing. And so I don't know what they're looking at next. I mean, the synthetic marijuana thing was the most recent event they had.
Okay, thank you. Moving along then, the Environmental Advisory Council, Ms. Burns?
I wasn't able to attend the September meeting, and I looked for the minutes, and there were none posted yet, but the next meeting is October 28th, and I should be able to attend that meeting.
Thank you. Okay. We'll go back to old business and the 2010-2011 goals and objectives. And if you turn to the minutes, under old business, the minutes of the September 20th, 2010 meeting, the three broad areas of focus for our 2010-2011 goals and objectives are as follows: animal management, child and school health, and public health education. We talked about using communication channels like Radnor Health Matters, which we have done in the past, the public school e-minder system, and the Radnor Township website. And except for the public school e-minder system so far, which is a tremendous idea and probably a great tool for us to hook onto, we have done some things with regard to the township website on a number of issues, as well as continuing to have past programs from Radnor Health Matters on available to view on the Radnor Township website. So we're moving well along.
Herb? Herb?
Yeah.
I just wanted to say that I am in touch with Andrea Chapago from the school district and have asked if she or someone, similar type of person could come to our next meeting, Board of Health meeting, to talk about the issues, the health issues that the school district identifies as primary, or if not, because of the time, no one can do that. And I would let other people know to see if anyone else could come, would meet with them, her or whoever she might say are the appropriate people to find out, again, from the school district's perspective, what health issues they think of, and so that at our next meeting we could hopefully have that on the agenda, either with the person here or that I would have had this meeting before our next meeting, so we could talk about that and see how we could work together.
That's a good idea, and I'd appreciate if you'd follow up with that. Again, I think using the e-minder system for a lot of things, the flu shots, for example, and what's different about them this year than last year and why people should get them. Ms. Mosier-Mills, who is...
I just wanted to ask, because I saw a thing, but the link didn't work from the school district website. Have you been notified about the school offering flu shots on site this year? Because it said October, it said they're offering flu vaccine in October, but then the link to it didn't work, so I didn't know, was that...
This year I got one through my doctor's office, but I don't think I've heard anything about through the school this year. I don't think so.
I had heard about it through the school too, and I think that I heard about it through the e-minder system. Then I went in onto the school page and it did link for me. I guess the day I checked it, the link went through because it had the dates of the administration and then a form that had to be filled out.
Okay, so they are offering it, and were the dates in October? Do you have any?
They were. I know Radnor Elementary School already had it, and the middle school already had it, but there were 3 other locations, and I don't know. I just made the note
Okay,
for my.
great.
Okay. Ms. Mosier-Mills has given me this evening something which I only have the one copy of, but I'll endeavor to get this out again, probably via email to all of you between now and the next meeting. It's a list of teen health issues, and if I may, I'll just read what some of them are. One is sleep, why students aren't getting enough sleep, how to get more benefits of sleep, and how to fall asleep more easily. Healthcare after high school, specifically targeted at seniors in high school, something that's probably very important. Focus on questions students have about where to go if they're sick, how to get medication in college. Concussions, that's something we've talked about in the past. Sports players, focus on what they are, their effects, and how to avoid them, concussions. Infections, depression, what causes it, potential treatments, and or people to talk to. Relationships with parents, driving, especially targeted at sophomores getting their licenses and permits. Nutrition, healthy eating, snacking, etc., and the positive effect it can have on a person's life. Stress, how to deal with anger, frustration, stress, etc., in a more positive way. And that's the current list that Allison Mosier Mills has put together, our student intern. And I thank her for doing that. So that certainly can form the basis of a discussion about issues that seem to be important to high school students in our township. And we can profitably start from there, at least for that given population. Okay, so look for that, and we'll undertake to discuss those more fully as to how we can address those issues. And together with hooking on to the e-minder system, I think we'll be in business at that end. Any further discussion of these? What I'd like the board members to do also is to, in addition to these other issues, not specifically perhaps related to teens, but other things that we can either discuss, put on the scroll, put on the township's website, do a TV program on the township's cable channel, any other issues that the members here think we can, would be important for us to address over the next several months. Thank you.
I have a general question, and it has to do with, if we put something on the website, is there a way to know how many times it's hit? I mean, is that something that's tracked, just so that we can assess if that's been an effective way to communicate things, or should we try to find ways to drive people to the website? If, you know, that's probably the simplest way to communicate different things. I have no idea.
Our IT person just stuck his head out and said yes.
Oh, instant gratification,
Jim,
thank you.
that's Jim Doling.
Jim
who's
Doling,
in there broadcasting us to the universe, or at least our immediate part of it.
I have a question too. Before coming in for the meeting today, I was at the American Heart Association's. They just put up a new website, and I had been to a meeting of that, some of the changes, and their website, www.heart.org, has a lot of some of the issues that we've been talking about, especially with the food and exercise, and had some programs for the school to actually look at. But when Allison talked about the healthy snacks, there's actually a place that you could click on for healthy snacks and healthy snacks for after the program. So I was just wondering if there was some way, like on our webpage, if, like, as far as getting other places to click onto for the Heart Association, if that's, I don't know how to do that, so I was just putting it out there.
Well, again, that's something either Mr. Doling or Ms. Kahn does. Larry Taltone would know specifically who the person is. And
I'll look into that. I think it can be done, yes.
Recommendations for the compression-only first responder CPR came out, so it'd be a worthwhile link to have that all included.
Ms. Burns, would you mind repeating that website for?
The website is www.heart.org/heart.org, which is all one word. But if you go to the heart.org, you can get into a lot of different things, which would include, which I was also reading, and why I was almost late. I was reading the new guidelines that are available, and some of the different programs for those new guidelines.
Thank you. Yes, that brings us to new business. Any new business for this meeting? If hearing none, then the meeting stands adjourned.
Whoa. I want to figure out how we're going to talk about these issues. I mean, okay, so I think great list. I have to think that the list I come up with from the school district. I mean, I'll certainly bring this to, that discussion, unless, of course, the person comes here, in which case, we can all bring it to her or him. But, so, I mean, I guess I think it'd be great to, sort of divide this up and have us take some responsibility for organizing discussion at the next meeting on these topics, or, I mean, what should we do with this list? That's my suggestion is that we divide it up and, and that whoever has those topics,
Well, I wasn't sure
come
that
up with
everyone had it
something.
in front of them. Well, the first thing I was going to do was to try to get it to you
Yeah.
via email, so, pardon me? Yeah, as part of the email, I can ask for volunteers to work on specific issues and come with ideas to our next meeting as to how we can address these matters and when.
I did bring a hard copy, which Larry is copying, if that's helpful.
Okay. Then we can have it before you leave today.
I do think it's a good idea, even if we visit each month with what we've accomplished, because, this is a nice accomplishment, the rabies thing. Hopefully, we'll be able to keep it moving forward, but then we can see what we can either bite off that's easier to accomplish and chip away at some of the items, just not to lose track of things, because there were a lot of good ideas.
Manageable bites.
I mean, one of the things that we had talked about that was a lot like the e-minder system through the schools, is there any way to allow the community to sign up for Board of Health e-minders, or just a notification that the website's been updated? Because if we put all these useful links on, or there's Rabies Prevention Day or whatever, if people don't happen to be on the website, they may not know that there's useful information that's been updated. And I did see down the side of the Township page, you could sign up for different sorts of notifications, like emergency notification and other types of things. I didn't know if that might be a useful place to have, find out when the Board of Health web page has been updated with a useful link or something like that. That might be simple, just because I don't know how many people find their way to our website, and there is a lot of useful information there.
Well, I think somebody could just email I'm sure there's a place on the e-minders to say, if you want something announced here, please email this. So, we could just do that. Email the e-minders to
So
say,
to go
please
through
add
this-
to put an announcement in the elementary, middle, and high school. Thank you. E-minders to check out the Radnor Township Board of Health website.
I think that is definitely a good idea. And then I guess to capture those in the community that don't have children in the school system, maybe it would be possible for them to sign up for a direct notification. I can try to look into that with Mr. Doling.
Thank you. We've just gotten the high priority and additional goals list. One of the things that is on this list is the review of the Delaware County Public Health Study findings and draft a position paper. Dr. Leader has done that. Unfortunately, I did not receive it until midday today, and I didn't have an opportunity to forward it on to the rest of you. So you can look for that. She's drafted a position paper for us that comes with some questions, as well as her suggestions for what the content of that position paper should be. But as I said, I didn't get it until midday today, and then due to a busy afternoon, just didn't have a chance to forward it on to the rest of you. Well, with the again, with some of these goals, for example, just picking out the child and school health goals, I think we need to be clear, and the third bullet is liaise with appropriate Radnor Township School District staff to discuss our concerns and identify means to achieve mutual goals, because the other two aren't achievable by this board acting alone, obviously. We need to get with those folks and do a number of things, the e-minders being one of them, special programs that we might sponsor in the schools, age-appropriate issues for elementary, middle, senior high school, those sorts of things. But we really need to have those discussions with Dr. Shapago, if she's the appropriate person, as a precondition before going forward. I would think we need to hear what they're doing, what they want, what they see us helping them with, and that sort of thing.
I agree with that, Herb. So, I think we will either do that at the next meeting, or it will be done, prior to that, and I'll present, whatever the results of that discussion were. I mean, optimally, it'd be great if someone could come here, but if they can't, I don't want to wait a whole nother month for that.
Okay, are you going to make the contact with Dr. Shapago, or shall I? I mean, we both know her.
I have already, and
Okay.
I will pursue.
Because if we can get on her calendar as early as possible, I'm sure she's more than willing to come here. It's just a matter of what her schedule is. Okay. Anything else for this evening? Okay. All right, thank you very much. Then motion to adjourn.
So moved.
Meeting is adjourned.